I'm just going to speak a little bit about my area of research. I was in diabetes, and I'm going to tell you the impact this is going to have on diabetes for children is huge. 60% of the kids we see in clinic, because they have a chronic disease, have California Children's Services, which covers the financial burden and the financial support. If that goes, then their insurance goes. And that's what counts for getting, today diabetes is a disease that's treated by technology. You see them on the TV, Libre, Dexcom, all these continuous glucose sensors. First of all, they all came true because of research funded by the NIH in basic sciences. They didn't come from industry. They progressed into industry and now they're available. Taking that continuous glucose data, adding an algorithm which adjusts the insulin delivery using an insulin pump provides what is colloquially called an artificial pancreas. But it has dramatically changed the risk of long-term complications. I started out in diabetes 50 years ago. Diabetes is the leading cause of kidney disease, eye disease, blindness, and kidney disease is kidney failure, and amputations. The lifespan of a child diagnosed was 25 years. Now it should be a normal lifespan. We don't see those complications because of this ability to control the glucose. The problem was not having adequate glucose control. This is providing that. It came from a tremendous amount of NIH funding. They funded a number of the pivotal trials that allowed this to be approved and then accepted by insurance companies. But you got to show the study to show it works before someone's going to fund it. And we're in dire need of losing that. Plus our training programs. There's people that we're going to have grants. The grants were turned down. If you're trying to hire someone and you don't know if you have funding to bring them on board, you lose all that potential. We had people coming all over from Europe to work with us in diabetes research. That's not happening. People are afraid to come here. So at any rate, please organize. I think that's really critical. I think showing yourself, being present is really important because it has to be a growing effort throughout the whole country. We got to let justices know we got their backs. Thank you.